Thank you for tuning in today for our session on traveling in retirement, a topic that inspires excitement, possibility, and often a long list of dream destinations. Retirement opens the door to an entirely new chapter, one where your time is finally your own, your schedule becomes flexible, and your travel bucket list can start turning into real life adventures. Today's webinar is designed to give you inspiration, practical guidance, and helpful tips to make those dreams become a reality. My name is Chelsea Chartrand, and with me is Derek Dudka, who is actually tuning in from sunny Mexico. And we are senior wealth advisors at Chartrand Dudka Wealth and Legacy Partners of CI Asante Wealth Management in Oshawa, Ontario. A couple items to note before we start. Please keep your cameras off and microphones muted as we are recording this session. Please hold your questions until the end. We have dedicated 10 to 15 minutes for a Q&A session. And throughout the presentation, please type any questions that you have into the chat box on Zoom, and we will answer them at the end along with the questions that were submitted when you registered. Okay, so today we are going to be covering the following topics, beginning with the benefits of traveling in retirement, how to stay safe and healthy, travel insurance essentials, and tips on how to plan and budget for travel. Derek will lead us with the benefits of travel.
Well, thank you. And I used my seniority in the company to volunteer for this. We thought, how can we do a webinar on travel unless we actually experience it? So I volunteered to go to Mexico while you're having cold weather there. It's very nice and sunny here and warm. Sorry that you're getting a bit of a blast of snow there in Oshawa area. But there's so many benefits. And I'll just cover off a few key ones, and I can tell you from practical experience, this is very, very true. Travel gives you a chance to get out of your day-to-day routines, which is one of the most effective ways to reduce stress. We're feeling pretty stress-free here right now. Being in a new environment helps the mind reset, whether it's nature, a beach, beautiful beach here, a historic city, or simply somewhere quiet. Even short trips can provide a mental pause, lowering stress hormones and improving mood. Many retirees find that combination of slower pace, fresh scenery, and purposeful relaxation helps them return home feeling recharged and mentally lighter. And I might add, even for people that work, now that there's so much working from home, people can travel and enjoy travel even while they're working, as long as they've got an internet connection and have the ability to work remotely. So travel naturally encourages movement, walking through towns, walking along beaches, exploring local attractions, participating in tours, swimming if you're by the ocean, or even if you're not, most places have a pool, light hiking. Even these kind of gentle activities support great benefits health-wise. Your heart condition gets better from travel or from hiking, walking, maintaining mobility. One thing, if you're walking in some of the older areas of cities, you have to be careful. It's great for your balance because they're on cobblestones and things like that. So you need to be cautious. But also, again, it really tests your balance at times. Traveling introduces you to new sights, new sounds, new foods, new people, different languages. Today, we're going to experience a Mexican food tasting. They're doing a little presentation downstairs at our resort, and we take a little Spanish lesson. Not that we know a whole lot of Spanish, but it's fun to learn a few things. And so there's all these activities that engage your mind, help you feel refreshed and better. You can learn at any age. In fact, so when you stop learning, you really start dying. So these mentally stimulating activities help support both healthy cognition and aging, and contribute to a greater sense of vitality. So again, from this personal experience here, we've got a beautiful beach that we walk alongside and into the waves, nice warm water. And the culture is different. Hear people speaking in Spanish, trying new foods. It's really great. So you can have a lot of benefits from traveling. So I'll let Chelsea go on to some of the more technical aspects.
Okay. So we'll go over some health and safety items here, beginning with safety. It's always good practice to check the the federal travel advisories prior to travel, especially if you're traveling abroad, as we're not usually familiar with all the things that are happening abroad. The travel advisories typically categorize risks into 4 levels: normal precautions, high caution, avoid non-essential travel, and avoid all travel. So they provide critical up-to-date information on security, health, and local laws, essential for informing travel decisions. Now I'll be talking about some scams and fraud. So with the ever-growing prevalence of scams, here are a few tips you can do to prevent them while you travel. Do a little research before you go. And when I mean little, I mean a lot. The more research you can do, the better. Look up the most common scams in the area you're visiting. Knowing what to expect helps you recognize red flags quickly. Simple awareness is your best defense. Um, be cautious with your belongings. Keep your wallets, phones, passports secure and out of easy reach. Pickpocketing is still the number 1 issue tourists encounter. So to help reduce this, you may consider only bringing items that you absolutely need. You can limit how many credit cards you bring, how much cash you bring. Um, and in terms of credit versus debit, credit cards typically have added fraud protection, so they are better to use than a debit card. It's also important to verify taxis and transportation. Literally any service that you plan on using, just verify that it's from a reputable source. Only book accommodations through trusted platforms and be skeptical and trust your instincts. Be skeptical of helpful strangers and high pressure sales tactics. Usually those are the people or the things that are going to try to scam or fraud you. And again, one of the most important things is to trust your gut. So I'm going to provide just a few examples of some common schemes that happen through travel. And one of them is actually before you actually travel, but when you're booking travel, be cautious of those free vacation or gift scams. They'll offer you a free trip that requires you to pay taxes and fees up front. But if you must pay to claim a prize, it's usually a scam. There's also some fake vacation rentals. So usually if something's too good to be true, it is. Scammers will create fake listings for high-end properties and they'll list them at a low price. So you think you're getting a real steal, but they're actually stealing your money and your personal information. One of the more common ones that a lot of people have heard is the timeshare scams. This is more applicable if you have a timeshare, and if someone contacts you claiming to have a buyer for your timeshare, even if you've never listed it, someone might try and contact you saying, "Oh, I have a buyer for your timeshare," and they'll start requesting installments of money for their services. And it ends up that they're not actually a real estate agent, nothing. They're just trying to get your money. So there's a few ways to protect yourself is never pay up front for anything like this. Verify the person's licenses. So are they a licensed real estate broker? And always ignore unsolicited contacts. So if you're not trying to list your property and someone tries to get a hold of you, just ignore them. If you are ready to list your property, you can go seek out a reputable source. And then over the next few slides, we'll get into the health and legal aspects of traveling. So we'll start with mobility-friendly travel. So as we age, we typically run into some kind of mobile issues. So there's a few things that you can consider before traveling to help make things a little easier for you. The number 1 is plan with accessibility in mind. You can check for accessible rooms. You can see if there's elevators or how far the proximity is to elevators. You can ask for airline wheelchair assistance. So when you get to the airport, you can hop in a wheelchair and be escorted around the airport. If you're renting a vehicle, you can ask for a vehicle with extra legroom. such as an accessible vehicle. However, just note that many cities require accessible vehicles to be pre-booked at least 1 to 2 days in advance. So it's always important to plan ahead and make sure things are all set up for when you actually are traveling. Number two, pack smart. You can bring a lightweight foldable mobility aid such as a cane, walker, travel wheelchair. I know Amazon probably has all of these things that are readily accessible to you, likely can be delivered to your door the next day. Also, pack medications in your carry-on in case your checked-in luggage gets lost or stolen. You'll have the medications right there with you in your carry-on. And bring a simple medical summary, just in case anybody needs to know what kind of medications that you're taking. You'll have a summary right in your back pocket. And use compression socks for long flights. It'll help reduce swelling. Next, you should ask specific questions. So, such as, is this shower fully a roll-in or just a low lip? What height are the beds? Are there grab bars in the bathroom? Can you guarantee a room near the elevator? Hotels often label things as accessible when they're not fully accommodating. So details really matter when it comes down to making sure that things are actually accessible to you and your capabilities. Pace the itinerary. So give yourself some more buffer time each day. Avoid back-to-back activities. Include seated attractions, so things like river cruises, train tours, museums with benches so that you can take a break. And it's important to plan rest breaks every 90 to an hour, every 90 to 120 minutes. Overexertion is one of the most common issues for seniors traveling with mobility challenges. Some of the activities you might consider is choosing activities or companies that specifically mention wheelchair accessible, slow paced, or seniors tours. Or if it has like minimal walking on it. Typically, these types of activities will be specifically marketed for seniors, and which means that they'll likely be accessible. So looking for terms like mobility friendly, step free, or accessible route are important terms to look out for. Also, assistance services. So, as I mentioned previously, airport wheelchair assistance, porter services for your luggage, so you don't have to carry around your own luggage, hotel bell staff for mobility equipment. So, if you didn't bring a cane or if you need something, it's likely that the hotel would have something there for you. So, you can just ask. And then also cruise as accessibility programs. Cruises are often the easiest option for mobility challenges because everything is centralized and it's flat. Like, unless it's a bumpy day on the ocean, typically it's one of the most mobility friendly traveling options. And some destinations that you might consider that apparently are mobility friendly, according to the description, is I've never been there personally, but Barcelona, Spain. They have flat walkways and accessible transport. London, UK. Apparently, they have really excellent accessible transportation options as well. And San Diego in the US, Vancouver, and cruises were all great options if you're looking for a mobile friendly destination. Obviously, it's important to do your own research, but those are some options. Okay, so now we'll start going over some tips of how to make your flight more comfortable. So first one is choosing the right seat. So there are specific seats throughout the plane that might be better for you depending on what you're looking for. So I'll start with a few. The aisle seat is easier for movement, easier for bathroom access. So if you know, are going to be drinking a lot of water, or maybe you know that you're going to be having to go to the bathroom more frequently, you'll likely want to choose an aisle seat. The front of the cabin is usually a smoother ride, it's quieter, and there's less walking. Bulkhead seats, they have extra legroom, but typically no under seat bag storage. And the exit rows. They're also great for leg room, but if you have mobility issues, they're typically not allowed, as you'll have to be able to move quite quickly if there's an emergency. Next, managing circulation. As I mentioned previously, using compression socks, dressing in layers with loose, breathable clothing, having a small footrest or inflatable foot pillow for leg positioning. During the flight, move your ankles and feet in circles, flex and point your toes, stand and stretch as much as you can. And these tiny movements can help prevent stiffness and swelling. For cushioning and back support, again, you can pack a lumbar support pillow that are travel sized, neck pillow, which are quite common, small foldable seat cushions if you have tailbone or hip pain. And yes, all of these items are allowed and permitted on flights. And lastly, hydration is key. Flying dehydrates everyone, but especially seniors. So it's important to drink water regularly, though, yes, it does likely lead to more bathroom breaks. Avoid caffeine or alcohol, and bring some lip balm, maybe some nasal spray, and some moisturizer. And by utilizing either all of those or at least some of them, hopefully it'll help make your flight a little bit more comfortable. Okay, so lastly on the health side is some medical considerations. So you can never be over prepared. So number one is to plan for emergencies. Print or save a digital copy of your travel insurance policy details, including the phone number. So if anything does happen where you need to utilize your travel insurance, you'll need the phone number on hand. And you should have the digital copy of all important documents, actually, not just your travel insurance, just in case the paper copy gets lost or stolen. Make a note of local hospitals, walk-in clinics, and pharmacies before you travel. So wherever you're going, check to see where the nearest one is in case you need it. Also learn the local emergency number. So for us, obviously it's 911, but what is it in Barcelona? I'm not sure. So look it up. Consider carrying a printed medical summary in your wallet or a medical alert bracelet. I know my husband's dad used to wear a heart necklace. He had a heart monitor on. So things like that, just make sure that they are on and viewable to others. If you have a medical device, make sure that you check the specific airline guidelines in advance. There might be certain limitations, or if you need to plug it in, make sure that there's a plug. And it's always important to bring backup. So if your device is battery operated, make sure you bring plenty of backup batteries and also adapters if where you're going, like I know in Italy or some places abroad, they have different plug outlets than what we use in Canada. So just make sure that you're bringing those adapters that you need for your device. Packing medication. So they suggest, or I guess the best rule of practice is to pack at least one extra week's worth of medications in case your trip home gets delayed, or maybe you need to take more medication than what you usually take because you're doing more activity, you're sore, you might need some more medicine. Storing the medications in your carry-on luggage instead of your checked baggage. Does your medication require refrigeration? If so, make sure you plan for it by bringing an ice pack and an insulated bag, or some other plan. And depending on the medication, a doctor's note may also be required. So just make sure you check that before you're traveling and set reminders to take your medication. Traveling is usually busy, especially on arrival and departure days. So it's always better to be over prepared than under prepared, especially when it comes to your health. Okay, so that covers off the health part. Now we'll just move into a little bit on the legal side. So some things to keep in mind, especially if you're traveling for quite a long time, like a month or more, you'll want to make sure that your important legal documents are updated and no changes need to be made before your trip. So preparing essential legal documents like your wills, power of attorneys, and emergency contacts before extended international travel is critical to manage potential medical or financial crises, and ensuring trusted individuals can act on your behalf and prevent legal complications. So updating your wills, establishing a power of attorney for both finances and healthcare, and leave your detailed emergency contact list with trusted individuals, ideally 2 to 3 weeks before departure. And while, okay, you have a will, you have a POA. Okay, now let's look at them, make sure that they're up to date, make sure they're properly signed and witnessed and notarized to be legally binding. A lot of people these days are using the online resources like Willful to create online wills and whatnot, but it's important to make sure that those are done properly and legally binding before you travel. Hey, so that covers off that section. Derek, anything you want to add before we move on to travel insurance?
No, I think that's really key that, again, it doesn't happen very often, but there are times or those rare occasions when someone is incapacitated, needs to access the power of attorney. The powers of attorney and executors should be aware that you're going away, should be aware that their power of attorney or executor know where the documents are so they can use them if need be. So that's just a little additional thing.
Awesome, good. So moving on to travel insurance essentials, and it is quite the hot topic. We'll be covering some limitations for both OHIP and travel insurance, and also reviewing some options you may consider when purchasing your travel insurance. So starting off with limitations, specifically with OHIP. So I'm not sure if you recall, but back in January of 2020, the OHIP out of country travelers program was briefly eliminated, but shortly thereafter reinstated after a court challenge by the Canadian Snowbirds Association. So for a brief point there was no OHIP out of country travel coverage. But even once it was reinstated, it is quite limited. So the travelers program, and again, this is for out of country travel, not for in country, that's different. It'll cover up to $400 a day for emergency inpatient services and $50 per day for emergency outpatient services. So as you can see, not really a whole lot of coverage, and we all know how expensive medical things are. So it is still advisable to purchase private comprehensive travel insurance, as OHIP only covers a small fraction of the actual costs for emergency medical services outside of Canada. Within Canada, OHIP still covers some emergency services, but it's not comprehensive. And also, it only covers up to the rates allowable in Ontario. So if a hospital in another province charges more than the Ontario rate, you will be responsible for the difference. Also, services like ambulance, prescription drugs, and air evacuation are often not covered even within Canada. So it's very important. It's almost always recommended to just get your own travel insurance policy. And even when you do purchase your own travel insurance policy, there are some things that are not included, such as pre-existing conditions. Travel insurance requires pre-existing conditions to be stable, and there is a standard for what stable means. So you want to make sure that you check that. And it's required to be stable for a specific period, which is typically anywhere between 3 to 6 months for ages 60 to 70. And what stable means is no new symptoms, treatment changes, or hospitalizations within that set amount of time. If you have any unstable conditions, they're typically excluded, but there are certain waivers that are available if you purchase it early enough, which I'll cover shortly. And it is also important for seniors to honestly disclose their health history, as inaccuracies can void coverage. And that waiver I was talking about, so there are options that if you purchase your travel insurance shortly after the initial trip deposit, they usually give you anywhere between 14 to 21 days to purchase this. It can sometimes allow for a pre-existing condition exclusion waiver, which protects you against sudden changes in health between the initial trip deposit payment and when you actually leave for the trip. Also, stability requirements often tighten with age. While those under 55 to 60 may require 3 months of stability, those over 70 often require closer to 6 months and sometimes up to 365 days for specific policies. It's always important to review the pre-existing condition exclusion section carefully of each of whatever policy that you end up purchasing. One common pitfall that we see when it comes to insurance is relying solely on credit card travel insurance. This is the major pitfall. Credit card travel insurance often provides inferior protection compared to standalone policies, particularly for older adults. Key risks include lower coverage limits, short trip duration caps, and strict eligibility requirements. Also, significant exclusions for pre-existing conditions and high-risk activities. So if you plan on going parasailing or something like that, it's likely not included in your credit card travel insurance. And again, read the fine print. You need to know all the details, especially if you have any kind of health concerns. Coverage differences, we're going to be looking at the next slide. So outside of the typical emergency medical travel insurance, which protects you from unexpected health-related costs while traveling, so for example, emergency hospital and medical treatment, emergency ambulance services, emergency dental care, prescription drugs for a limited period, medical evacuation and repatriation, also 24/7 emergency assistance. Those are all things that are typically included in your emergency medical travel insurance. However, there's also a few add-ons that you might consider adding that, of course, come at an extra cost. The first one being trip cancellation, which reimburses prepaid, non-refundable expenses like your flights, your hotels, your tours, if you must cancel your trip before departure due to a covered reason like illness, severe weather, or family emergencies. Then there's trip interruption, which reimburses the unused portion of your trip and extra transportation costs if you must return home or interrupt your trip after it has already begun. There's also baggage protection, which covers lost, stolen, or damaged baggage and personal items during travel up to the specified amount, which is usually around $1,000 or so. And it may also include reimbursement for essential items if baggage is delayed. Another add-on is medical evacuation. This is typically included in comprehensive medical plan, but if it's not, you can add it on. And it covers the cost of transporting you to the nearest adequate medical facility or back home, which can be thousands of dollars. Okay, so we are providing you now with a sample. If you've never purchased travel insurance before, it can get quite costly, especially if you get one of those all-inclusive packages. So we typically use a company called To Go Travel Insurance. It's a Canadian company. We do sell travel insurance ourselves through Asante Insurance and Estate Services. So if you or anyone that you know as is kind of considering travel insurance, reach out to us for a quote. But for a sample quote here for a couple they're both 60 and they're traveling for a week. So it's 8 days total from start to finish. They both have a clean bill of health and they don't smoke. They're applying for a policy with a $0 deductible, and it would be $115 total for just the emergency medical plan only. However, if they wanted to add on the trip cancellation, trip interruption, and baggage, which is typically called an all-inclusive package, they'll be paying close to $600. The emergency medical portion provides up to $5 million per traveler, so quite the extensive coverage. The trip interruption for this particular plan covers up to $25,000 per travel. The trip cancellation covers up to $2,500 per traveler. But note that these coverage amounts, they depend on how much your trip actually costs. So if your trip costs you $25,000, you can purchase coverage for up to that amount. It'll just cost you more. And then the baggage coverage in this case is up to $1,500 per traveler. To help reduce the cost, if you're on a little bit of a budget, you may choose to apply a deductible of your choice. For in this sample, we put a $0 deductible, but you may consider like a $300 deductible or a $1,000 deductible to help reduce your cost of travel insurance. All right, so that covers off travel insurance. I'll let Derek take over the next part of planning and budgeting, but if you have any other comments, Derek, on travel insurance, feel free.
Yeah, the only thing I would add is that many, not all, but many company plans, you have group coverage through that while you're still working, and it has some of the international travel, medical coverage. Some companies, many companies offer the opportunity to then take on that plan yourself. I mean, back in the old days when it was all the generals, General Motors had, I remember when my father-in-law retired, there was up to 6 months out of country coverage. Basically, it was just a real golden package. They no longer offer that. The maximum is 3 months. So those snowbirds that want to go down for 5 or 6 months have to come back for at least a day to reinstate the 3 months. And it doesn't cover quite as much as it did. And so we're finding that because travel insurance, especially to the States where medical costs are very high compared to many countries, travel insurance is something very, very worth considering. And if you do have the option to take on your group plan when you do retire, that's something certainly worth looking at if you plan on traveling at all outside the country. So let's talk about more fun stuff of traveling. So there's many different ways of traveling. And so you can fly, you can drive, you can take a boat, take a train, depending where you're going. So you've got transportation costs. Now, accommodation. We did a number of years ago, purchased a timeshare unit. Still trying to do the math on that, whether it's a really good deal. So you can't measure everything purely in dollars. And every time we go for a review, they're always telling us, oh, buy some more, buy some more. And we go, that's okay for you because you live close by and you can go to all these different places. This is, it's again, depending where we go with it, we still have to book a flight that's a 3 or 4 or 5 hour travel time, and that often costs as much as the transport or as much as the accommodation. The timeshare that we chose, we like it. It's beautiful. We know exactly what we're getting when we go. It's beautiful locations, multiple locations that we can go to. We still have to get there. And we chose one that's not an all-inclusive because we like cooking our own meals. I could probably make a good case for eating myself out of the extra money and get my money's worth at an all-inclusive. We don't drink water is the main drink that we have, so we would certainly lose out on the drinking part of it, which is a great benefit for some people that like to drink on their holidays. And so it's all these different costs. There's a nice kitchenette in our units where we have. So we go shopping at local grocery stores and we go for dinner occasionally to certain places. So then there's other activities. Where we are right now, there's people doing parasailing and there's all these trips to different parts of Mexico, the different tourist attractions and so on. They can add a whole lot of money on top of it. So you need to look at the whole picture when you're going, because that's something that can really, really dampen the desire to travel. Is you think, oh, well, I'll just go on a quick trip here. And when you look at transportation, accommodation, the food, the activities you want to do, and then buying travel insurance, oh, that's what you thought was maybe a $3,000 trip is now a $10,000 trip. So money shouldn't be the sole object of the game. Why are you going? There's lots of benefits of it. And so treat it as an investment in your health, in experiences and so on. But you do need to figure out what it's going to cost you. One thing is an example from an actual client. She was a university professor, loved to travel. She said, I've got a good pension and it'll cover all my basics, but I love to travel. And man, it's so expensive. She ended up taking a sabbatical about 5 or 6 years before she retired. And she came back after that year just grinning from ear to ear. And she said, Derek, I says, I think I'll be able to do it. I said, what do you mean? He says, well, during my year off, I took 3 major trips, one to Europe, one to the States, and one someplace across Canada. Said all 3 of them cost me about the same as one usual trip that I take when I was teaching, because of course, when you're teaching, you have to travel at high time. So when you're retired, one of the benefits of being retired is that you literally can book last minute flights. You can get these discounts and sell-offs. You can generally cut your travel budget by anywhere from 20 to 50% by going on the shoulder seasons, when it's not spring break, when not everybody's there, when not everybody else is off. You'll miss out on some things, like you're not going to be uh, seeing some of the real summer spectacular things in July and August, which are really high seasons, or maybe if you want to go at Christmas time. But you can go in June and in September, you can go in May and October. There's different things that you can do. So you can really, really have a big impact on your budget. If there's a particular type of traveling, like cruises, we have a friend that thinks it's dollar for dollar cruises is the best package you can buy. And in some ways it is. All your meals are included. You just have to get to the ship. And then you may or may not do any other excursions and so on, but you can have a complete trip just by going on a cruise. And if you go on cruises, or if you go someplace on regular occasions, then look at, whether it's an airline, you can get airline discounts because you get points for it. Same thing with cruises, same thing with hotels. So take a look at, if you're going to be traveling a lot, are there ways that you can say, okay, I'm always going to travel Air Canada or WestJet or whatever, because I'll build up points on that. I'll get better flights, a little extra perks, those kind of things. There are also some discounts for seniors, and for those, the Snowbirds Association has all sorts of things. CAA has things for seniors as well. So take advantage of reaching that magic milestone. And it depends on where you're traveling and what organization you're with, but sometimes quote senior starts as early as 55. Don't have to wait till you're 65. And one of the big things that I've learned from clients is that they often come back from their trips, say, I need a vacation, because they tried to pack so much in. And partly that's more so when they're working, because they've got a week off or 2 weeks off and they're going, and it's hurry and get as much stuff done as you can. When you're retired, maybe instead of flying to Florida for a week, you decide, well, I'll make a trip of it and we'll tour slowly, take 3 or 4 days to get down to Florida, spend 2 weeks there, take another week or so coming back. Again, build your tours into things that you're going to enjoy, and not get really, really tired and exhausted from trying to pack too much into a short period of time. As Chelsea sort of mentioned earlier, like, become familiar with unfamiliar environments. I've had a couple of clients that, again, didn't need massive medical coverage, but they were traveling like in Greece. Beautiful, interesting, wonderful. I haven't been there yet. Hopefully make it there someday. But walking on all those old cobblestones, was looking at all the sites, didn't look at where they were walking, tripped, broke their ankle. The rest of the tour was not nearly as enjoyable for them. Again, not a big medical expense and not anything earth-shattering, but it sure spoiled the rest of that trip. So take attention. If you're going to someplace, understand if they speak your language at all, if there's, if you can use Google Translator or whatever. As Chelsea mentioned, look out for political disruptions. Sometimes there's weather disruptions as well. And even with the best of planning, we can't always tell what's going to happen. We had one client that came back. They'd planned this river cruise. They'd heard about river cruises. It was, I think, the Rhine. So they went this one year. That happened to be the year that there was a flood. So the rivers were so high. The first day, the riverboat made it as far as they could. They were able to make it through to the next town. But after that, the rivers were too high. They couldn't go underneath the bridges. So what they did was they brought a bus and they took them to the next place where they would have gotten off and toured. And the client said, it was okay the first day or two because you're not going very far. And it was, half an hour drive, 2 hours. This is, by the time we got to the end of the trip, we were spending more time on the bus than we were in getting out and looking around. It kind of put a damper on it. Unfortunately, there was nothing they could do about that because nobody predicted the weather. And that was like 1 in 25 years where the riverboats weren't able to go along. So that's sort of some of the key things. Like I said, there's so many different types of traveling, and different ones will have budgets. But whether you look at a timeshare, whether you look at going to all-inclusives, whether you do Airbnb, whether you do your own kind of things, some of the things that we like to do when we go traveling and we've even done this in Canada and in some of the major cities. Most major cities have hop on, hop off tour buses. And one thing that it does, it gives you a great insight into sort of what the key historic or touristy areas are in the city. And you can decide oftentimes we don't even hop off the first time. We just take it around to see what's there and decide where we want to go back and spend more time. The other thing we do is a walking food tour. And again, most places have that. We've done this in Toronto and Ottawa and Montreal, as well as other countries. And it's great because usually it's in a historic part of town. It takes you 3 or 4 hours. You're not walking that fast, but you hear all about the history of the country and you get some great food. And even though it seems like just a little bit that you're getting, by the time you go through the 5 or 6 stops, you're quite full. So these are things that you can look into. But when you're planning for travel in retirement, I mean, that's where we can help you a lot. That's part of what our retirement planning is we look at what are your regular lifestyle budget, what you need, heat, hydro, those kind of things, how often you need to buy a car, but what's your travel like? And again, for people that, like my client that was a teacher, a university professor, thought, oh, I'm never going to be able to afford travel. Once she discovered that you can travel on shoulder season and off peak, you can get a lot more traveling done and you have more time. So you can take the time, you can perhaps drive to some places or take the train. You can just spend a little bit more time and get some benefits that way. So what's really the travel budget that you need? And oftentimes we find in the first few years of retirement, the first 5 to 10 years, it's sort of go. You want to travel and do all the bucket list things. And we would encourage you to do that because you never know when health can change. Health can change just like that, the snap of the fingers. And all of a sudden, all those trips you thought you were going to do 3 or 4 years down the road, you're not going to be able to do them anymore because of health issues or something else, some other circumstances. So we really try and get people to say, if you enjoy travel, plan for it, help us build some sort of budget, do a little bit of research before you retire. What kind of travel do you want to do? Are you going to be cruising 2 or 3 times a year? Or are you going to be doing river cruises, which are much different than the ocean cruises? Are you going to be traveling internationally? Is it mostly in Canada, mostly in the States? What about currency exchange? Because again, there's a couple of reasons people aren't traveling as much to the US. One of them is the dollar doesn't go nearly as far as it used to, the Canadian dollar, when you convert back to US. And then there's other reasons people don't go there. We'll just leave that alone for now. But what kind of budget is going to be a $5,000 a year, 10,000? Are you going to do a big trip every other year? Do you want to do 2 big trips the first year? We can help you with those numbers. We can build a dedicated travel spending policy. We can say, okay, let's how many years do you want to do this? And we've done this for a number of clients. You're going to travel quite a bit. We're putting in like $20,000 a year or $30,000 a year for the first 10 years of retirement. And then we slowly work it down from that. We can, and for some people, we've set aside a separate fund. Just, we've set up a separate notational account. It's still part of their overall portfolio, but here, this is your travel budget, your travel fund, still invested, so it's still growing. If you don't use it, then we can grow it. But we also have, and this is more so when people are working, but we've even had to do in retirement because people, it helps them. They'll set aside money from their investments every year. They'll say, okay, take you, whether I spend it or not, I want to allocate, pick a number, $10,000 a year for travel. So whether they spend it or not that year, we allocate that and we create this sinking fund so that, okay, if you want to go traveling next year, you've now got 20,000 because you didn't use the 10,000 this year. If you're looking at going to different countries with different currencies, it might be worthwhile to watch. And if you're buying a large amount, if you're going for quite a long time, buying a larger amount, going through a currency trader to get either US dollars or euros or wherever you're going for that. Let's see what else. Income budget. I think that covers it because again, we can help you with it. Some people have, again, even from CPP or old age security, they'll use that as their travel budget. They'll say, here, I want to add this. If they've got room in their TFSA, they'll put it in their TFSA and they'll say, okay, all your CPP money is going in there. That's just your travel money, and so on. Did I miss anything on that, Chelsea?
No, you got it. The most important thing is planning ahead. So as we said, and especially in our retirement plans for our clients, we have a dedicated expense that's for travel. So knowing kind of, as Derek mentioned, what you're going to be doing for travel and retirement is very important. And then either setting up a specific fund or creating that sinking fund where you're contributing small, regular and planned amounts of money into that, either like a high yield savings account or something that's not going to fluctuate with the markets, keeps it safe for you for your planned travel. It helps you avoid debt, and it also helps you avoid draining your emergency fund. So those are just a few added things, but yeah, you covered the main points there. And of course, if anyone has any other questions for their scenarios specifically, they can ask. But we'll go to one more closing tip here before we head into questions.
One thing just on that travel budget is to finish up on that. One thing we're starting to see a bit of an increase in is people taking families like for a big anniversary, or it's just they want to get together with the family, which sometimes is only 3 or 4 people, but sometimes it's now getting up to 10 to 12 people. And that costs a little bit more. So we do need to budget for that and count on that, because usually it tends to be the retirees that are paying for it. We found from an early age that, a lot of people say, oh, our kids don't like to travel with us once they hit teenagers and so on. We found out that as long as you're paying, they like to travel with you, whatever age they are, even now. So anyhow, one last thing for people that maybe are a little bit more adventurous or love pets. There are these, some of you may have tried these out, trusted pet sitters, trusted house sitters. I know we had a friend that they were gone, I think, for about 8 or 9 months, all in the US. Or I should say mostly in the US, some in Canada, but in the US and around. And they spent, very little time in hotels where they had to pay for them, because they're a member of this trusted pest sitters. They love dogs. And so they found places. There's people willing to let you literally stay in their mansions for free as long as you look after their dog or their cat or their bird. So there's a little bit of work involved, but you get some beautiful travel opportunities. I know our son and his family live in England. They have a dog. They've used people from this on occasion when they've come over here to visit. So there is a way of getting your accommodation covered. And some of these places you can stay for a month. Again, it depends on how long the people are going for, so depending on their situation. But it's certainly something worth looking into. Again, there's trusted pet sitters, so if you're looking after pets, but there are some that just want somebody to sit in their house because they're going to be gone. They don't want it to be empty. So if that's of interest to you, you get to live as the locals live and see a part of the country that maybe you wouldn't typically see. for no accommodation cost. All right, I think
Okay.
that brings us to the end.
Yes, thank you. So the next or the last 10 minutes are for questions. So we did get some questions when you registered, so we'll go through those. But if you have any others, just type them into the chat box on Zoom. If you open your Zoom, there should be some options across the bottom, and one of them should say chat, and you can type in your question there. Alternatively, you can call or email us after with any questions. We also want to make you aware that we are present on social media. We have Instagram, Facebook, LinkedIn, and YouTube. We have recorded this session and we post all of our webinars on our YouTube page and on our website. So if you'd like to go back and listen, or if you have any other friends or family that you think might be interested in what we talked about, you can forward them our YouTube link. But let's get into some questions. So one question was, is it best to plan for one large and lengthy trip occasionally or a few smaller trips more regularly? And I have just a little bit of an input on this. So really the best choice depends on your own travel personality, what your budget is, what your lifestyle preferences are. Obviously, those bigger trips will be more expensive, so it comes down to affordability there. But it also comes down to if you like variety and more regular breaks, or do you prefer more of the settle in and stay vacations? While longer stays usually have a larger upfront cost, you can often get better nightly rates. And smaller trips are easier to fit into a monthly or quarterly budget. Um, One suggestion is you might consider more of a hybrid approach of, say, one big trip and two small trips each year. The two small trips will give you something to look forward to often, while the big trip satisfies your big travel dreams. Any input from you, Derek, on that one?
Well, that's great. I'll just add on to that yeah, there's things you can do. Again, if you're a little bit more adventuresome, like my friends were, they traveled for 8 months, hardly paying anything for accommodation. And because it was all within Canada and the United States, they drove and they charted out their trip. That was quite a long trip. And that's not for everybody for sure, but you can find those kind of accommodations for 2 weeks, 3 weeks, a month. Um, and so it really is, as Chelsea said, what's your preference? I know people that they don't like to be gone from home for more than 2 weeks, and that's wonderful. Great 1 or 2 week vacations are wonderful. Cruises, trip down to the sun like we're having right now for 10 days gets you reset and recharged. Part of it is budgeting, again, where you're going, what kind of trips that you're doing. Are you going for pleasure? Are you going for learning something to stimulate your, maybe go to Greece and do a dig somewhere. That might be a little bit longer when to me, part of it is what your flight time is, because if you're going through 6 or 7 time zones, you probably want to spend a little bit longer there because you're going to lose a couple of days at least, if not 3 or 4 days, getting over jet lag. Those first few days are not likely to be nearly as enjoyable. So you don't want to be flying to England for the weekend and come back because you probably will have been jet lagged all the way through and not really enjoyed it. Um, and that's really it. Is what do you enjoy, and what gives you a really sort of wow, that was good. I'm really looking forward to going somewhere again.
Hmm. Okay. Another question is, how much of my annual income should I budget for yearly travel? We typically say, I mean, again, this depends on your own personal situation and how much you can budget for, but we typically say anywhere between 5% and 15% of your annual retirement income. Um, you can use towards discretionary travel, depending on your goals, your comfort level, your overall budget. A good starting point, I would say, would be 10%, as it strikes the right balance between enjoying the travel while also maintaining long-term financial stability. Another question was, for someone who has not done a lot of traveling, how can I get into a traveling mindset? I'd say start with curiosity. So think of the things that you've always wanted to do or the places that you've wanted to see. Start doing some research on those, what it would cost, the different activities that you'd like to do. Also, you can start small and close to home. So instead of, doing a month-long trip abroad, you might consider starting with some day trips and then moving into some weekend getaways that are 2 to 3 days long, and then kind of expanding from there. I would say also trying guided or group travel at first. It'll help you learn without having the added stress of having to plan every little detail. And also traveling with someone who's more experienced with travel is helpful. They can help guide you and get you used to certain things. You can also practice travel at home. So you can watch shows about travel, you can read travel blogs, you can attend travel webinars like you're doing right now. You can also maybe learn a few words of another language, especially if you're, going to a specific location that has a different language. I would say those are a few things that you can do to kind of kickstart your little travel bug.
I think that's a great point you talk about is curiosity. What's something you'd like to learn about? Where do you go? Because one thing, and this sort of ties in with budget and with retirement and in general, is what we've found with many of our clients, because they've been good savers and they've been saving for retirement, they're in this habit of saving and not of spending. So it's sometimes hard to get people to spend, whether it be on travel, whether it be on anything at all. And we find that oftentimes we have clients going into retirement and still continuing to save and save and save. And nothing wrong with that at all. But we do try to say to people, like, you saved so you could enjoy your retirement. And if you're enjoying your retirement, doing everything you're doing, that's great. But that's what this money is uh, for travel, for um, pleasures at home, abroad, wherever they are. So learn to spend. We can help you say, like you can spend this much, you can spend this much extra per year. We can do those projections for you as well. So sort of here's the minimum you should, or the maximum you should spend, and here's the minimum you should spend, and give you that kind of range. So Chelsea alluded to it, but if you have any young, children, grandchildren that like to travel, they would be happy to be your travel guide to take them somewhere. You pay and they'll show you around. They'll get the apps and everything for the travel things to make life easy for you while you're traveling. And that's a great bonding time with family as well.
Great. Well, that kind of brings us to the end of the presentation. We have just a few minutes left and all of our questions are answered. But if you had any other questions specific to your own situation, feel free to reach out. We can help the best we can. Again, we have recorded this presentation. So if you either want to rewatch it or share it, we will be sending it out via email at the end of the week and also posting it to our YouTube page and to our website. But lastly, we just wanted to thank you for your time, for attending and for watching. We hope you got some helpful tips and preparation for your next trip, and we wish you all the best. Thanks and take care.
Have a great day.